Mr. Chairman. I move to strike the last word, and I want to thank Mr. Mullen for raising this discussion about value. Today we're here to talk about what Congress can do to make prescription drugs more affordable. But I, along with my colleagues, particularly Mr. Shimkus from Illinois, wanted to just also explain another way to reduce costs in the American health system. Rare genetic diseases affect approximately 6 to 10 million Americans, and half of those affected are children. Traditionally, getting a diagnosis has taken an average of 5 to 7 years. Those years are filled with too many expensive, unnecessary tests, too many days spent in a hospital, too much guesswork, and think of the pain those families feel about trying to figure out what's wrong with their kid. They just can't get the answer. This gauntlet has come to be referred to as the Diagnostic Odyssey among providers. But answers are available to many of these children and families today if only they could access them. So Representative Shimkus and I, along with a host of others, have introduced H.R. 4144, the Ending the Diagnostic Odyssey Act, to help get those answers to more families. This bill is endorsed by more than 100 rare disease groups, the Genetic Alliance, and Rady's Hospital, Children's Hospital in San Diego, who's been a key player in diagnosing and treating children like these. Rady's Children's has provided whole genome sequencing for some of these pediatric patients. Over the course of the project, they spent $1.1 million on sequencing. In so doing, they have saved children from 226 days in the hospital, 66 days in the ICU, 8 biopsies, 4 tracheostomies, 8 invasive procedures, and 68 additional genetic or diagnostic tests. When taking into account all of these procedures, the total costs avoided range between the cost of the sequencing and $2.4 million. The average savings of $3,000 per patient occurred before anyone left the hospital. It doesn't even account for the savings of treatment over their life because they caught these things early. And at this time, I'd like to yield to Representative Shimkus to discuss the bill as well.
Well, I thank my colleague from California. And the basic premise is before we can treat patients, we really need a diagnosis. And this, as Scott has said, this diagnosis will save money. Whole genome sequencing is the most comprehensive genetic diagnostic available. It gives providers the genetic blueprint to decipher genetic disorders. Sometimes these disorders can be treated with something as simple as a supplemental vitamin, but providers need to know what the disorder is before they can treat it. And sometimes there isn't a treatment available today, but knowing what the disorder is allows these families to find one another and make a case for further research and clinical trials. And in addition to what this bill would mean for these families, it's also a good investment. No one benefits when Medicaid or families are forced to pay for unnecessary tests, procedures, or hospital stays. No one benefits when mom and dad have to take time off to care for their little one. Finally, this bill includes accountability. It includes reporting requirements to ensure these dollars are being well spent. With that, I want to thank my colleague for carrying this legislation. I look forward to continue to work with him, and I yield back my time to him.
Thank you. Thank you, Mr. Shimkus. And Mr. Chairman, I know the calendar is packed the remainder of this calendar year, but I would like to continue to work with you and your staff on a path forward for this bill, which is the quintessential way to save money and to get better treatment.
And we will certainly work with you on that, Mr. Peters.